All right, this video is going to focus on depression in adolescence. Now, this word depression, a lot of people have heard the term, and you might have different associations. A lot of times when people think depression, they think sadness. But when we talk about clinically significant depression that would need some kind of treatment, like therapy, medication, whatever, it involves more than just sadness. And the thing is, most people have experienced sadness at some point, but they might not have experienced severe symptoms, or they may have had other symptoms that actually count towards depression that don't necessarily involve sadness. So first of all, let's define the term clinical depression. All right, so with clinical depression, your symptoms are severe enough that they interfere with your life in some way. This is more than just, feeling a little sad because something undesirable happened to you. This is something where, it makes it difficult for you to function. So this includes more than just sadness. So this includes feelings of hopelessness, lethargy, worthlessness. It can also include anxiety, guilt, sleeping and eating problems. A lot of times people don't recognize the physical symptoms of depression as part of depression. Now, for clinical depression, it has to last 2 weeks or more. All right, so it has to. It can't just be like a one day feeling really bad about something. Now, what causes clinical depression? Lots of things. This is one of those things that there are lots of different pathways towards developing a particular set of symptoms. There are biological influences, psychological influences. There is just no one way to develop depression, essentially. And in an abnormal psychology or perhaps a biopsychology or neuroscience class, they might go into some very specific genetic or biological risk factors. Right? For my class, I'm going to kind of keep it broad since this video is being created for a survey course on development. Now, if we use the term major depressive disorder, this is a specific diagnosis, major depressive disorder, MDD. This does require that you have at least one 2-week or longer episode where you have feelings of deep sadness and hopelessness, and it disrupts all normal or regular activities. So this is where it makes it difficult for you to get yourself to school, do your homework, interact with your friends, do the stuff that you would normally do. Sometimes you will hear people talk about depression where it makes it difficult to enjoy the things that you once enjoyed. There are lots of different specific experiences that can go along with major depression or having major depressive disorder or having a major depressive episode. Now, 15% of adolescents at some point will meet the diagnostic criteria for a major depressive disorder. So this is why we have to talk about it. And this is why this is inserted into this part of the textbook in my lifespan developmental psychology course. This is a time where you see the risk increase for depression. Now, it's not like you can't get depression in adulthood. We also have risk for depression in adulthood. And for all the things that go on, they're still there, and you also have adult stressors on top of that. But there's a lot of depression that is visible in adolescence. So the risk doubles during adolescence, all right? And there are some important gender differences. Girls have twice the risk for depression than boys, and that continues into adulthood. So in adulthood too, I always used to joke like it's depressing to be a woman, but you still have that ratio where just being a woman is a risk factor for depression, essentially, if you interpret it that way. All right. So with the differences, let's see. The cause for the gender disparity. Well, there are biological, psychological, and social differences. Biologically, the menstrual cycle and estrogen. Estrogen fluctuates during the menstrual cycle. And when I say cycle, that's the time from the beginning of one menstrual period to the beginning of another menstrual period. During that full cycle, which on average about 28 days, but some people have less or more, during that cycle, estrogen levels fluctuate. And estrogen is linked to mood. So you can have mood fluctuations as part of the menstrual cycle. That does not mean that if somebody is experiencing depression that you can just disregard it and say it's probably just your period. It's probably just your hormones. That doesn't mean that you can invalidate someone's emotional experience. Now, what about psychological? We mentioned rumination in a previous video where you kind of dwell on thoughts and you keep revisiting thoughts and experiences and trying to figure out like what happened, what went wrong, where you kind of just don't let things go. We do see some differences where girls are more likely to engage in rumination than boys, and rumination is correlated with depression. So, that is one possible explanation. And then some social explanations. It can be very frustrating. This is going to be such an oversimplified statement, and there are entire college courses about gender and the gender experience. But being a woman, being a girl, being a woman can be very stressful or difficult, especially given the setting. If you are in a setting where you are dismissed for being a girl, or you don't have the same opportunities, it's going to vary from setting to setting, but those can be very, very frustrating. Another important difference that people will point out is in terms of depression, owning up to your negative emotions, your negative feelings, it may actually be easier for girls to admit that they have depression or depressive symptoms because we have one of these social roles, this gender socialization phenomenon that we see happen is that a lot of times we discourage boys from talking about feelings or owning up to feelings. Girls, it's more socially acceptable to own up to having feelings at all. So, that could possibly explain the differences, but really it's kind of all together. These can come together to explain some of the gender differences that we see. But the gender differences are definitely there. Study after study, we will find that there's greater risk in girls and women. Let's see. Okay. The next big thing that we have to talk about in regards to depression is there are many different possible consequences and symptoms that can go along with depression, but the one that we really would be concerned about is the risk for self-harm, for suicide. So suicide, taking one's own life. Most people who experience depression do not attempt suicide, but the very fact that someone could, and that's such a serious consequence, of course, we're concerned about it. We would like to reduce suicide rates, please. And so some important, let me get my notes here. Yeah, some important differences and whatnot. All right, so girls are more likely to experience depression. Boys are more likely to actually go through and complete suicide. And by the way, sometimes you'll see the term successful suicide attempt. I really hate that term because that's not a success in my eyes. But so I like to say completed suicide. All right. But boys are more likely to actually kill themselves. Now, there are various reasons for that. Sometimes when I teach in person, I'll have students say, well, that's because when girls talk about suicide, they don't really mean it. They're just trying to get attention. When boys talk about suicide, they mean it. They're serious. Well, that does not seem to, at least in research, that does not seem to be the explanation that comes about, that is supported by the numbers. A big factor is that when boys attempt suicide, they are far more likely to use more lethal means, like weapons, like firearms. Girls are less likely to have access to firearms in general and less likely to use them for suicide attempts. And a huge risk factor for suicide. A huge risk factor for suicide is having a firearm in the home that the individual has access to, where they know where it is, they know how to get to it, they know how to use it. And so anyone with a firearm in the home, you need to be cautious. You need to know about that additional risk. That is a huge risk factor for suicide. Having it there does not make the person suicidal. The person has to be suicidal. But if they are suicidal, having that access makes it more likely that they can actually kill themselves. So that that's what that finding is. Now, I mentioned when girls talk about suicide. All right, well, when you were just talking about suicide, thinking about suicide, we have this term suicidal ideation. Suicidal ideation is like thinking about possibly, wondering, well, what would happen if I did that? Girls are more likely to engage in suicidal ideation. Another term is parasuicide, and this is like self-harm behaviors, like cutting, if you've heard of cutting, other self-injurious behaviors. You can have self-injurious behaviors that are not necessarily meant to be lethal. And so we are starting to get more research about parasuicide and looking at different risk factors. It does seem to have, not the exact same risk factors as, actually lethal suicide. And we do have evidence that girls engage in that more. And then another important term is cluster suicides. And this always makes me think of the movie Heathers. And I know they have a musical and they did a remake and a reboot. I'm talking about the classic late 80s Heathers, Winona Ryder, Christian Slater. I'm Gen X, all right? I have a strong identity with the original Heathers, forgive me. All right, if you're not familiar with the basic plot of that movie, it involves it seems to be a series of suicides at a particular school. Turns out they're actually murders, but the idea is the school is trying to deal with the fact that a lot of their students, and a lot of them are very popular students, are taking their lives, and they're worried about, well, what, the other kids are going to follow suit. Well, you can see this. Sometimes you will have in a community, one person will have a very known public, everybody will know that the suicide occurred, and then you'll have other people will follow suit. And, it could be that someone who's been thinking about it, they've been engaging in ideation, and they see the other person go through with it, and it can be kind of inspiration, even though I don't like that term because we usually associate that with, inspiration to do things that you should do that are great for you. I always feel like every suicide is not desirable, and that's, my personal opinion. The other thing is that depending on how the original suicide is handled, sometimes you will see that the person who took their life will be celebrated. The attention they didn't get in their own life will suddenly everybody will be talking about, oh, they were so wonderful, they were so great, oh, I'm going to miss them so much. They get a lot of positive attention. People will celebrate this individual. And so sometimes people who wish that more people would celebrate them and attend to them, they will think, well, if I did this, I would be celebrated like that. Of course, you wouldn't be able to enjoy it because you were deceased, but adolescents don't always think straight, and depression robs you somewhat of your ability to think straight. You don't always think rationally when you're depressed. All right, and so sometimes the one possible explanation can be that you see the attention and the celebration, and you want that for yourself. Now, so this means that experts on suicide, when they give advice to schools for how to prevent cluster suicides, they give advice that can seem kind of counterintuitive or even cold or cruel. They'll say, okay, so the student commits suicide, don't cancel classes, don't have a big service, a memorial where you celebrate this individual, go about business as usual. And a lot of people will think, well, that's cruel. We can't just not acknowledge that this death happens. We need to cancel classes. We need to have a special service. Like when I was younger, we had a student who did not commit suicide, but they attempted suicide. They ended up in the hospital. I think I was like in 6th grade. And we had a special day where instead of having our normal classes, we talked about death. We talked about death. I think we even read poetry about death and dying. And we had someone come in and talk about suicide. And folks, I was not thinking about suicide before that. But afterwards, I was thinking about suicide. It was on my mind. I don't think I would have harmed myself, but I definitely was having the thoughts like, well, what would happen how would my family react? How would the other students react if I did that? So it's that's that personal example about how it kind of backfires when you stop everything to talk about this. It can have instead of convincing people you should not do this, you may inadvertently inspire them to follow suit, to have a copycat, have cluster suicides, and we don't want that. So we often say, business as usual. Do not cancel class. Keep keep doing what you would normally do. Acknowledge, make therapy available, make counseling and therapy available for the students that were close to the individual who committed suicide. Acknowledge that, yeah, this is unfortunate that this happened, but have business go on as usual. All right, so this is going to conclude the video about depression and including suicide in adolescence, and the next video is going to be about rule-breaking, law-breaking behavior in adolescence.